From WAVY News 10, this is a breaking news alert.
We're cutting into regular programming to bring you the latest information on the coronavirus. I'm Deanna Bettineschi. Virginia Governor Ralph Northam is speaking now from Richmond. Let's listen in live.
Well, good morning, and thank you all again for being here, and for those of you that are watching and are listening from home. It is 11 o'clock a.m. on a Sunday, a time when many Virginians would ordinarily be sitting in church pews. Faith is even more important at times like these, so I greatly appreciate and I urge our faith communities to use creative ways to connect while maintaining social distance. Since yesterday, 67 more people in Virginia have tested positive for COVID-19. And I'm sorry to report we have had our third death, a man in Fairfax who was in his 60s. My sympathies and those of the entire Commonwealth go out to his family and loved ones. We're seeing this sharp increase in positive tests in part because we do have more capability for testing coming online. But we're also seeing it because this virus continues to spread. We talk about flattening the curve, but make no mistake, we are still in the early stages of that curve rising. How high and how quickly those numbers rise is up to you and me and every single Virginian. It is clear from talking daily to our public health officials that COVID-19 is going to be with us for a long time, months, not weeks. We need to begin adjusting to that reality. I know that makes people anxious and fearful. It is difficult to live with uncertainty. But the sooner we all adopt these new ways of living, the sooner we will all get through this. We know that a majority of people who get sick will experience mild to moderate symptoms. So as a country, our priority must be to protect the people who are most vulnerable, older people, people with underlying health conditions, and our healthcare workers themselves. We need them to stay healthy. So here's what we're doing to protect them. We're making sure that we dedicate as much personal protective equipment, PPE, as possible to our healthcare workers who are focused on COVID-19. Just yesterday, the Virginia Department of Emergency Management shipped a major supply of PPE to emergency medical services, health districts, and hospitals. This includes gloves, gowns, face masks, and respirators. We are also actively reaching out to companies for help making and distributing PPE. My team has been on the phone around the clock reaching out to CEOs across our Commonwealth. Our message is clear. It is time to step up. I have been very proud in my administration that we have built the best state in the country in which to do business. Now, Virginia needs your expertise in manufacturing, logistics, and in the supply chain. As an example, yesterday, Home Depot delivered a shipment of PPE to our Department of Emergency Management for distribution to our health facilities, and I thank them. We're calling on hospitals to reschedule elective surgeries, and many have already done this on their own. That is a way we can free up healthcare workers and preserve PPE, emergency equipment, and the blood supply. The Centers for Medicare and Medicaid Services has guidelines for surgical and dental procedures that our medical facilities and dentists can follow. I also encourage Virginians who can to telework and use telehealth whenever possible, so you don't have to go to the doctor's office. Every one of us has a job to do to fight this virus. That is why it is so critical that everyone stay home as much as possible. Do not go into crowds. Do not have gatherings. I know that most Virginians are hearing this message, and I thank you all for doing your part. But I also know that some people are not listening. And I want you to know, you are putting every single one of us in Virginia at risk. Again, I remind our localities, if a restaurant is violating the 10-person, the 10-patron rule, you need to shut them down. To our colleges and universities, no more fraternity parties. And for everyone, social distancing does not mean congregating on a crowded beach. This is not a holiday. This is not a vacation. Please stay home whenever possible. Virginia is watching. Everyone knows the right thing to do. Everyone needs to be smart. We know people have to go to the grocery store and to the pharmacy, but wash your hands and keep a distance between you and other people. Now I'll ask Virginia State epidemiologist Dr. Lillian Peek to talk about today's health updates. Dr. Peek.
Good morning. Like the governor, my heart is heavy today with the news of the Fairfax resident who died of COVID-19 yesterday. And condolences to the family. I'm keeping you in my thoughts. I also want to thank my colleagues and friends and many others around the state who are working tirelessly to lessen the impact of this virus on our lives and on our communities. As the governor said, we will continue to see more cases in the upcoming weeks. Most people will have mild illness, but some are at more risk. So we appreciate everybody's effort in working together to respond to this virus. As the governor said, this morning we are reporting 67 new cases. That brings us to a total of 219, 95 in the northern region, 70 in the eastern region, 28 in the central region, 20 in the northwest, and 6 in the southwest. Most of the new cases were reported today from tests done at private labs. So it is heartening to see that we are having more increase in testing in the Commonwealth. Our state lab continues to have about 1,000 tests available, and we're looking at how we can stretch that capacity and use those tests wisely until we have more available. Thank you.
Thank you, Dr. Peek. Again, I want every Virginian to hear this message. You have the responsibility to help slow this virus. It is up to all of us to protect the vulnerable people. It is up to all of us to act responsibly and avoid crowds. We will win this fight together, but we are in it for a long time. We will come through this. Again, thank you on a Sunday morning for tuning in, for listening. It is our intent by doing this that we keep Virginians safe, 8.5 million to be close to exact. And we also want to continue to provide accurate and updated information. So we appreciate all of you for being part of this. I'll be glad to take questions.
Maybe a question for the Secretary of Public Safety. We've had multiple people reach out to 8 News saying that an inmate at Sussex 1 has tested positive for COVID-19. Is that true? Have any inmates in any state correctional facilities tested positive for COVID-19?
Thank you very much for the question. The question is information that is out on social media in particular that inmates have tested positive at any of our correctional facilities in the Commonwealth. The short answer to that is no. As of this moment, there are no positive tests in our correctional facilities. You know, in a time of crisis, it is so important to be truthful and honest with the public, and that's exactly what the governor is doing. We are being as transparent as possible. There are no positive tests. And as we have stated before, Department of Corrections has taken extraordinary measures to prevent the interaction that the governor speaks of, to stop the social interaction. We have suspended visitation. We have restricted, actually suspended transfers from local jails to our prisons. And I should mention, the Department of Corrections has now provided 2 free phone calls per week for our inmate population, so they continue that very vital interaction with their family and community. So again, we are going to do our best to continue to dispel the misinformation that exists, and that is why the governor is here before you every morning to give the truthful information. So I appreciate very much you asking that question.
And as a follow-up, similar subject, and for the governor, is the state considering a possible release of inmates who may be more susceptible to the virus if a problem were flagged?
Again, thank you for the question. The question being, is the state considering release of certain inmates who may be susceptible? You know, from day one of Governor Northam's administration, we have communicated to the parole board to review each and every parole-eligible individual over 60 years of age, because in the Commonwealth, we have geriatric release for those 60 or 65, depending on the length of their sentence. And so from day one, the governor has given that direction to our parole board. We are in communication with them to try to identify and expedite cases. I will tell you, we cannot release someone who does not have a place to go. The home plan for health care to be provided to that particular individual is paramount. I mean, it would be immoral, it would be uncaring to release someone from our correctional facility without a proper health care plan in place. So I can tell you, we are expediting any and every one of those reviews and doing everything we can to not allow the virus into one of our facilities, but then also to address it on an individual basis to expedite release if it is called for. And of course, public safety continues to be paramount.
So is the state asking for parole boards to keep in mind the potential for somebody who may be up for parole, who may be in a category that is more likely or more susceptible to getting COVID-19 in their consideration of that person's release?
If they are, yes, to answer the simple question. Again, if we can keep the virus out of one of our prisons, that is first and foremost, and that's why the interaction itself is being suspended. And of course, the governor already gave guidance to our local jails and the entire criminal justice community for those low-level offenders who would be more properly cared for at home. Use electronic home monitoring. There are alternatives to incarceration, again, to ensure a level of interaction between our staff and other inmates and reduce that to a minimal level to address this virus.
Along the same lines, we heard the calls to take steps to reduce the jail population last week. Since then, I've heard from several judges, several prosecutors are saying that they think it's actually safer to keep people in jail because there are no cases confirmed in jail right now, which would seem to go against the guidance that y'all have issued. We've heard. I guess I'm just curious if y'all respond to that. Would y'all share that sentiment? Would you respond to it?
The question being, the reporter, Ned Oliver from the Mercury, has communicated with various prosecutors and judges with respect to our guidance that there is a belief that those who are already in jail may in fact be safer than being on the outside. And that may very well be the case, but you know, with respect to a low-level offender, we were hearing from our local sheriff community that they would like to make space in their jail so that in the event of someone who would contract the virus, they would have the opportunity to isolate that inmate. You would not want that inmate infected to have access to the general population, for instance. So our sheriff community to us asked for direction, guidance from the governor so that all players in the criminal justice system would hear that message loud and clear that Some extraordinary efforts should be made for those level offenders who do not present a danger to the community to be considered for release for alternatives to incarceration.
Yeah, this is a follow-up along the same lines. Have any inmates been tested for COVID-19, and if so, how many?
Thank you for the question. The question being, have any inmates been tested for the COVID vaccine? When you say inmates, I can speak to our Department of Corrections inmates. I do not have the data on the jail community, though we are certainly engaged in those communications. But as you know, we have over 60 jails, regional jails, local jails, and sheriffs, independent sheriffs who run those jails. So amassing that information is somewhat difficult, though we are working very collaboratively and cooperatively in communicating. For purposes of the inmates, to date, I'm not aware of any who have actually been tested for the COVID. Some have been presented for testing and, frankly, haven't met the guidelines instituted and followed by Department of Health. I will tell you there was an employee of another one of our correctional, our public safety agencies was tested and was fortunately negative, and that was great news for the Department of Juvenile Justice. But to date, there have been none tested, and certainly, again, that's a piece of information we plan on being very transparent about.
Governor, as you look at what's happening in the state, and as you and your team are talking to CEOs around the state,
Yes.
what are you seeing and hearing about the economy, and what's your prognosis as a medical person for the state of the economy and what it's going to need going forward?
The question is, what about our economy? And I think, Greg, to look at how we're approaching this and in our discussions with CEOs and Virginians and the like, we are focused on the containment of this virus, which we have spoken a lot about, and how to do that most efficiently and effectively. We are focused on mitigation, that is, how we take care of individuals that become sickened by this virus. And then we are focusing on what the long-term implications of this virus are on our economy. And we're having daily discussions. As you know, we've made some changes in our tax, the timelines for our taxes, working with our businesses. We are in daily consultation with our Secretary of Commerce, who has communication with our business community, our Secretary of Finance, Secretary Lane, and then we are watching closely what happens at the federal level. I think as we speak, they're negotiating a relief package, and we have asked collectively as governors that a significant amount of that relief come directly to states so that we can use that to help our businesses, small business association loans, those types of things. So there's no question, Greg, that this will have long-term implications, long-term impacts on our economy, and we're taking that seriously and on an hour-to-hour, day-to-day basis, doing everything that we can to prepare Virginia for what we might be facing. And a point that I would make, and I certainly appreciate the question, part of our message as we speak to Virginians is that this is not a matter of weeks. This is a matter of months, and we're doing everything that we can to prepare Virginia for that and to, at the same time, keep our economy as strong as we can. This is a health crisis. That's what started this, and that's what the majority of our focus is and will continue to be on. And our economy will be stronger the sooner we can get the health crisis under control. So that's where the emphasis has been.
You mentioned a matter of months. Have you guys decided to extend the closure for schools as of now?
It's a great question, and as I have said, we have almost hourly communication. In this case, the question are, what are we doing with our schools? Because this is not going to end in weeks, we are in communication with our superintendents, with our Secretary of Education, and I anticipate an answer to that question at tomorrow's conference. So we will give guidelines. As you know, we have shut down schools K through 12 for 2 weeks. Today is the completion of that first week, so we will make that announcement tomorrow.
Yeah, I was wondering, do we know the number of cases now in either nursing homes or long-term care facilities? And then sort of a two-parter.
Yes.
Do we have an estimate of when the peak of this disease is going to be?
Great questions.
So we have heard about cases in nursing homes, and we're now looking at our data to try to analyze it by a lot of different factors, age, and risk factors like nursing homes, healthcare workers. So once we have enough numbers, which we are getting to now, we can look at that in aggregate or all together so that we can provide more information without identifying incidentally identifying an individual. So we'll be looking at that, and more information will be coming out. We can't really predict what the peak would be. We are continuing to follow what's going on in other countries, to learn about this, to look at different models, and hopefully with each week we'll gain more information.
And just to clarify, the data about cases isn't broken down into the granular level of what facilities they're occurring in. We don't have that information.
Right. I mean, with the teams on the ground doing the investigations and the localities have some of that information, but we haven't put it all together in an analysis yet.
There's rumors of a complete lockdown. Would you be able to address that for us?
You know, we have a lot of options on the table. We discuss this again by the minute, by the hour. We have taken aggressive measures in Virginia to protect 8.5 million Virginians, and I will assess what is going on in Virginia on a daily basis and make those decisions.
Just a quick follow-up to that. In the absence of sort of the broad surveillance testing, how would you make those decisions since you just don't have a complete picture and won't have a complete picture of the spread in communities? What other factors would you be looking at?
There's just a number of factors, and without getting into the weeds this morning, I mean, every morning our team, just so Virginians know what is happening, we meet at 7:30. We collect data from the day prior, look at the number of testing that we've done, look at the number of positives, look at the number of individuals that are in hospitals, and those are the main things that we're using to make our decisions. But it's a complicated process, but I will tell you I'm proud of our team. We've got great people that are working on this around the clock. And I want to emphasize to Virginians that a couple of things. We're in this for the long haul, months. That's one thing to be clear of. But we are taking every measure that we can to keep Virginians safe, especially the vulnerable population, and to prepare, as I said earlier, with Greg, what the long-term implications of this are for our economy. So a good team, we're all in this together, and we're going to get through this, but it's going to take some time. Could I just, I have one final announcement, if that's okay. We, in consultation, I believe, with a lot of you, we want to continue to do this on a daily basis, but we're going to move starting tomorrow from 11 o'clock to 2 o'clock. So for everybody listening from home, I will hopefully look forward to speaking with you all at 2 o'clock tomorrow. Thank you all again, and enjoy the rest of your Sunday.